I just wrote this, and I'm just going to read it, and then we can just sort of expand on it as we go. So cannabis and mental health. So as you all know, the combination of the two is still questioned by a lot of healthcare professionals. We have a lot of doctors at Canadian cannabis clinics, and a lot of them will not see anybody with a psych condition at all. You know, the DIN number protects doctors. A friend of mine just went to a doctor. He was very stressed. He hadn't been to a doctor in 25 years, had no medical history, no diagnosis, and he got clonazepam immediately. But yet if he wanted to come to my clinic to get CBD only, he'd have to have a diagnosis, he'd have to have all these notes and whatnot. So the big thing is the drug identification number that protects doctors, because the doctor does that, the pharmacist tells you how to use it, you're good to go. You know, cannabis doesn't have a DIN number. We don't know if it ever will, because there's more strains being created every single day. So are they going to have one DIN number for all of the cannabis? Or are they going to have it individually? We're not really sure yet, so that's something that we're sort of working on. But that's the big holdup with coverage. So every patient that comes in to see me says, can I get this covered? Some people are, and if you bug your insurance company enough, they might. It's not a given now that you're going to get coverage, but I have patients that are. You know, like even just for the length of the prescription, which would be 3 months, I have a couple of patients that, they're, I think it was Great West Life, decided they would cover it for that 3 months. Then our doctor wrote a letter to them and said, it's working, please continue coverage. The next 3 months was covered as well. So baby steps. Sun Life is just, I think it was last year or 2 years ago, came out with a big thing where they're paying the, covering a student's cannabis at McGill University. He has severe ADHD, so he was like the first one to get coverage for it. Sun Life also about a year ago came out and they recognized that smoking cannabis is not the same as smoking tobacco, and so that was a big thing. And what leads many people with mental illness or they're on other medications, are the side effects of those medications. You know, like I joke, and I hope that I'm not offending anybody when I say this, but I was on many cocktails of antidepressants, you know, Prozac, I tried lithium. Effexor and Wellbutrin was for 10 years straight I was using them, and then I went to Cymbalta. But lots of side effects, and honestly when I look back, they sterilized my gut, they stole my orgasm, and they made me a zombie. So that's me. That's not everybody, because I know people on Prozac who are very happy with how it treats them. With me, that's how it treated me. So yeah, one thing that I really see is, like, you know, doctors know all about the medications, but we're the ones that use them, you know, so we are sort of the experts on how this drug treats us, what side effects it gives us. And those are all very important, because if you're on one medication, you might also be on another one because of the side effects from the first one. And that's a big thing as well, because every pill has to go through all of your organs, and, you know, some people believe it can damage your liver if you're taking too much. So myself, I have been using cannabis for about 15 years. And I can tell you that it was all medicinal. I did it because it made me feel better. What made me start doing it is I took my dogs out for a walk, and I was stupid enough to let my dog off the leash, and she got hit right in front of me. So every single night that I went to bed, I would see that, and I can see it right now as if it was happening yesterday. And the only thing that shut my brain off so I could go to sleep was cannabis. And so that's how I started using it every single day. Whether that's good or bad, I don't really know. And for many years, I would go to bed at night thinking, I'm not going to use tomorrow, you know, I'm not going to, because I believed the stigma and I believed that it was bad for me and everything. But here I am, still using it. I've been legal for a year. It took me that long to get legal because I didn't really have a doctor who would really sign. And now that we have clinics like mine, it's great, because doctors don't know enough about cannabis to sign for you to use it. But all you have to do now is refer the patient to a company like us, and then our doctors are educated and can talk to them about it. So that's really good. Cannabis itself does have side effects, but really with all of the different ways that you can ingest it, I can control the side effects. So a side effect to smoking cannabis is lung damage, coughing, the smell. I can control that by vaporizing or by eating it. So that's one way. There are so many different ways to use this plant. I have a 74-year-old patient with osteoarthritis, and he roasts it in the oven, puts a teaspoon in his chocolate pudding every day, and he's thrown out his cane. He's not renewing his disability sticker on his license plate, and he was dancing in the waiting room showing us how good he feels. And all he does is eat it in his pudding. So, you know, lots of different ways, and some people believe that the different ingestion methods work on different kinds of ailments better. There's one Harvard psychiatrist, Dr. Lester Grinspoon, and he says that a tincture under the tongue is the best thing for migraines. We all in this room have a naturally occurring system that recognizes cannabinoids, just like your endocrine system. The reason nobody really knows about it is because it was found in 1992 by a bunch of Israeli researchers. So they took it a bit further. So they thought, well, if I have a receptor system in my body that recognizes something if I eat or smoke or whatever that plant, well, why do I have that? The body must make something that also fits. And so they proved. The body creates a hormone-like compound called anandamide, is what they've named it, and it fits into the same receptors. So the endocannabinoid system accepts plant cannabinoids and naturally occurring cannabinoids that are made by our body. And one of the, we joke that cannabis gives you the munchies. Well, there's cannabinoids in breast milk that fit into the very same receptors. So that's probably why, the plant cannabinoids would also have the same effect, possibly. So I personally, and a lot of other people, I believe we were meant to use this plant. I believe that humans bred the cannabidiol out of it, which is the non-psychoactive part of the plant, and they bred the THC into it because people like that couch lock is what we call it. It's a very relaxed feeling. People like that. That's what THC gives them if you use it by itself. I'm going to talk to you about how if you combine the two, real magic happens as though they were meant to be used together. CBD mitigates all of those psychoactive effects of THC, so when you use them together and you become experienced with that, you could go about your day and you would not feel any psychoactive effects whatsoever. So it's pretty awesome that way. So the reason it works so well for some mental health conditions is the receptors in the brain, which we call CB1 and CB2, are located in the region that controls emotions. Also, small human studies are showing that THC lowers the negative bias. And so I just came from a cognitive behavioral therapist session. My eyes are still red because I had a good cry. It's a good session when you have a good cry. So I kind of lost my train of thought there. And so what she told me, and which was a lifesaver for me, and I tell all of my patients this, when you're depressed, when you have mental illness, and you probably know this, when you're stressed and when you're in pain, your brain amplifies the negative. And my mom would say, growing up, she'd say, oh honey, just look on the bright side. Well, the bright side's a lie for a lot of us. We're not medicated. We don't see the bright side. I see what's wrong with me. I see what's wrong with the world. I don't see what's over there. And then I found cannabis. And I couldn't understand why I'd be so miserable some mornings, and then I'd medicate, and within half an hour I'd be planning dinner. I'd be planning on calling a girlfriend. I'd be planning on things to do, or I'd be writing or something. It really, really does. It lowers that negative so that everything else can come up. And you've heard people say that it inspires them. This is why it inspires them. So one of my patients that I just saw the other day, this was her first follow-up after using CBD only. She uses it for a compressed disc in her back, so it's a pain condition. So after we were done and I had her re-registered, I said, so how are you doing? Is it working? And she says, yeah, it's working. It's not perfect, but we're getting there. But she says, I'm painting again. And I'm doing more again. And she says, I now even have my artwork downtown in one of the stores. I said, how'd you do that? And she said, I just spoke to them and said, do you ever put artist work up there? They said, yeah. And I said, so tell me this. Would you have ever done that? Would you have ever asked her that? Would you have ever called yourself an artist before you started using this? And she said never. So cannabinoids, whether it's THC or CBD or whatever one it is, it lowers that you're not good enough feeling, or you can't do that feeling. And so now that I've fully accepted my cannabis use, I am on fire. It sounds crazy, and I'm not somebody who would ever normally say that. But, I'm just putting it out there, and now I write for these people, which is a relative humidity pack, and they're from the States somewhere. It allows me to forget about all those things that I don't do right, or didn't do right back there. And I don't know if you know much about cognitive behavioral therapy, but that's what that's about too, correcting the negative thoughts that, so cannabis helps with that, definitely. Another thing that I definitely think affects your mental health is your gut health. As we probably know, there's more serotonin produced in the gut than in the brain. So if you're not eating, or eating properly, or if you're sterilizing your gut by medications that you're taking, then it's not going to do its job, and it's not going to produce the serotonin that it needs to. So one of the side effects to cannabis is that people get their appetite back. And I've just recently gone through something when this job has given me, I used to have depression and now I have anxiety, but only before clinic days. And yeah, you know, it's, because of that, I don't eat very much anymore. I've lost a lot of weight and I don't have an appetite, and you know, I miss looking at a steak and thinking, I don't have that anymore, you know, because of this. So cannabis is helping me with that, but really, like, just that one normal basic human need of eating does so much. Cannabis helps with that. The one big basic need of sleeping, which is another thing that now that I turned 43, I can't sleep through the night. It's terrible, and I used to sleep like a baby all the time. Cannabis helps you sleep. That's a pretty good side effect. It helps another of the human basic needs. I really think that, and a lot of us believe, that cannabis is good for almost anyone in certain combinations because the different cannabinoids can do different things. And now with the legal producers, which I've sort of spread out some of their products, you can get something with only CBD, you can get something with lots of THC, you can get combinations of all of it. So it's all very streamlined now, and more being created every day, which is awesome. There's also another Israeli researcher right now who is trying to theorize that these other compounds that are in the plant are as medicinal as cannabinoids, and those other things are called terpenes. So like the thing that makes pine needles smell like that, that's pinene. The thing that makes lemons smell like that is limonene. And it goes on and on. There are about 8 of them, and they're all in the cannabis plant in varying amounts. So we used to think that was just whatever it was, you know, maybe just to attract the bees in its growing stage. Why ever would we have these terpenes in this plant? Well, those terpenes are therapeutic. And there's an Israeli researcher that is going to try to prove that those terpenes are as medicinal, if not more, than the cannabinoids, which is pretty cool, I think. Something that I wanted you to ponder is, like, if cannabis treats many gastrointestinal issues, which it does, and that's another thing. We have people who are on it for chronic pain, and they're saying, but I haven't had an irritable bowel syndrome update since I started, or outbreak since I started, you know, so it helps all these other things that you're not really taking it for. So what if the gut microbiome that we have an endocannabinoid system? And, you know, and cannabis is feeding those, and they're working better, and they're more healthy. You know, it just, when people talk to me, they think I'm a little bit far out there, but really I'm not alone. There's so many researchers now that see the value in this plant. And, you know, when people talk about, well, we should keep the pills, they're studied, all of the rest. Well, aspirin is the most commonly taken medication, I think, right now for anybody over 60, and it came from the bark of the white willow tree. We used to chew on the bark to get rid of a headache, and now we've reverse engineered, and now we have aspirin. So from plants come a lot of our medicine. Don't forget that, you know. And with this plant, we're trying to say you don't have a right to reverse engineer this plant. And you've tried, and it's not as good as what the sun, moon, stars, soil can do. You know, don't reverse engineer everything, in my opinion. And thanks to the Supreme Court of Canada, we are able to buy our bud and make whatever we want with it and ingest it however we want, which is pretty cool. Yeah, so I've already mentioned that patients, you know, who are taking it for pain will often say something like they're feeling less depression, they're feeling happy, their gut health is better, you know, their skin is better. It's amazing how feeding the endocannabinoid system feeds your immune system. And that makes sense, right? If you have a system in your body that recognizes it, probably took 10,000 years of ingesting that to create that in your biology. So it makes sense that they would all be connected and feed each other. One of the, you know, when we talk about side effects, you always talk about negative usually, but there are a lot of positive side effects to cannabis. Positive, improved outlook, improved gut health, improved sleep, appetite, creativity, concentration, mobility, and that is not with all of the strains, right? You have to fine-tune what strain you're going to use. So let me speak about that a little bit. So there are families of strains of cannabis that are well known to be a certain way. So like a Kush, you've probably all heard of that. That's an indica, meaning it is a family of plants that give you more of a body relaxation. And so people with chronic pain will use an indica quite often. It has quite a bit of THC usually. But if you want to do anything during the day, you're probably going to want to ingest something other than a Kush, because a Kush should be what you would use at night to relax, So then there's other strains of like a haze. You may have heard purple haze. Well, that's a class of strains that are from a plant that grows bigger. It takes longer to grow. They have long lady finger leaves on them, and it's more cerebral. So for anybody who has depression that locks you in, and that's what my depression is, it locks me in, and I need to come out to enjoy the world and see that inside isn't all there is. And that's what a sativa does. Now, you wouldn't smoke or ingest a sativa if you have a chance of having psychosis or anything like that. So indica, sativa. Indica is a big bushy plant, and it's always good for body. So anybody that has pain or needs help with relaxation, they're going to go for an indica strain, and that's just a whole different family of strains. And then there's sativa, which is more cerebral, as I mentioned. The ruderalis, that's something that is a very small plant. We don't really pay much attention to it. But the hybrid strains. So the producers that produce the cannabis for us now have hybridized a lot of this. So it's pretty amazing. People can get both things. They can get a little bit of cerebral wake up with some of that pain killing. And so now it's amazing. It's very exciting as a counselor to look on there and see, like Snoop Dogg. I was a little bitter when he came on because I thought, you're not even medicinal. You own dispensaries. I think you've been arrested for selling cannabis way back when, right? But yet he has this awesome strain, which is called Palm Tree CBD. So the rocker rapper Snoop Dogg is going to help you with your mental health and anxiety with some CBD, and that's awesome. And his strains are $9 a gram, which is not the most expensive that they could be, so I'm now pro-Snoop again. If you've proven that you care, then I'm on your side. Okay, so this is a visual that we just give out, and it just sort of gives you a little blurb as to what we do at my clinic. So basically, people will come in and they expect to be seen right away. And if you lived in BC and you're in the BC bubble, you probably could walk in and sit down in front and Skype with the doctor and say, I need cannabis, and you'd probably get it. And part of me says we all should use it, we all should be allowed to, but I can't feel that way. I have to realize that there are some people that have contraindications. Antibiotics are heralded as the #1 invention, and yet 6 people die every year from contraindications with antibiotics. So just because some of us can't use cannabis doesn't mean that it's amazingly medicinal for other people. We need medical history. So as you probably know, the #1 thing to treat a patient isn't physical looking over them, it isn't anything, it's medical history. And so we have to get that before we'll even book you in. And that's so that our doctor can look at all that and really get a good feel for whether cannabis would work for you. This isn't a place where they don't look at your medical history, and there are many times when our doctors won't prescribe you. And I brought somebody in, and the doctor said, no, I would like him to go see a psychiatrist and then come back to me. So they're very safe, I'm sure not every doctor is the same way, but ours at Canadian Cannabis Clinic follow the recommendations of the College of Physicians and Surgeons. So there are a couple of ways to come in. So let's say that your doctor, I think you should try it. I don't want to sign for you, but I'll send everything you need. So we'll have a referral form, which is one of the things I forgot to bring. It's a referral form. They'll fill it out. The doctor faxes that with any supporting documents to my clinic, or actually like the head intake, which is in St. Catharines. And then from there, it gets loaded into a file, and then the patient gets called and you're booked. Now, if the doctor says, I don't want you on that, I don't even want to talk about it, and this happens all the time. Doctors don't believe in cannabis, and they don't really... Let me back up. Some, and very few actually, but some doctors don't believe in it at all and they don't want anything to do with it whatsoever. So what you would do then is you would do a request for information. So we have a form that you would sign giving us permission to ask your doctor for more info. That's one way of doing it. Doesn't mean the doctor has to do it, right? And then in some they don't, and that might be what we need.
Yeah.
The government, Health Canada maybe should be hiring more people in these clinics because let's face it, the assistants and nurses are now taking time to help the cannabis program. That's a little silly, right? You know, how are we going to get support if they're not doing their normal work because they're now doing this work?
Yeah.
So the request of info is one way. Once again, that can be ignored, and it does get ignored. So buy your file. And there's a lot of people who just buy their file anyways. There's a lot of people who go to the doctor and at the end of the visit, can I have a copy of that please? And that goes into their file and that's what they have at home. There's a lot of people who have, I wrote a article last year when the Health City thing was down there about doctors bridging the gap. You know, I really think there's a gap between the patient and doctor now. You know, especially if you're using cannabis, you're probably not telling your doctor. And if you're not telling your doctor everything, then how can they treat you properly, you know? We try to fix that break between the patient and doctor, I think. So yes, buy your file. That in itself is a little maddening because it can cost $20 to $100 and you have no control over how big your file was because somebody else was making the notes, not you. But it is what it is. You know, possibly some doctors' clinics would give you their file for free. Either way, we need medical history. So when you come into my clinic, you're going to do a whole bunch of intake papers just to tell us exactly your point of view of what's going on with your biology and your history. Then you're going to go in and you're going to see an international medical graduate. And she's going to give you she or he is going to give you a physical going over, you know, take your blood pressure, talk about everything. She inputs that into the computer. The people go into the next room where they'll see the doctor by Ontario Telehealth Network. And so the doctor sees everything that physical international medical grad did, so then she can have a more, you know, educated assessment between that, the medical history that she has, that she's probably studied last night. Now she can sit down with the patient, find out what their needs are, decide if cannabis can work with them. So if she does that and they're approved, then she does a medical document, uploads it, and people come into my office. I go in and I open that medical document, see what she's been prescribed. Could be 1 gram a day, could be 0.67 grams a day, capped at anywhere from 5% to uncapped, and usually for 3 months. The longest a medical document can go is for a year. Then I'll go in and I'll read what the doctor has said, because they'll quite often put notes in there. And then from there, I can know what I should talk to this patient about to a certain extent. So when they come in, I just say, my name's Dianna. We're going to talk about how you're going to use the medicine. We're going to choose who you're going to buy it from, and then we're going to register you with that person. And I stress choose because it's a patient's right to decide who they're going to be registered with and who they're going to buy from. This program has just sped up so much, you know. I've been legal for a year, and it was only a couple months before that where you couldn't go to a clinic like mine. If you didn't have a doctor who believed in this, you were a criminal, you know. And so now I really think this is awesome. And for a lot of patients, I think that they think, oh my goodness, once I start using this, I'm going to have a P stuck to my head. I'm a pothead, and everybody's going to know it. I just say, no, try it out for 6 months. It's going to cost you a couple $100, but nobody's going to know that you're doing it. You know, try it. See if it'll work for you. And it might not, but it might. And that's the one thing. The follow-up days where people come and tell me how things... It's hard to keep back the tears because even just that woman who's painting again, that right there, you know, I never... In all the medication that I've been on, I was never on any that really inspired that. You know, I wrote before I was on antidepressants. I didn't write when I was on antidepressants, and now that I'm off them, I'm writing like crazy and blogging and getting published and all of that. So that's just one person, and is that causation and correlation or whatever that? I don't know, but I'm not alone. There's so many people who say, you know, that they are so much more now that they're ingesting cannabinoids. And to me, it makes sense because your body recognizes them. You're supposed to use them. You have a receptor system throughout your body who recognizes them.
Thank you very much.
You're welcome. Oh, thank you very much.
Yeah, it's great to
Oh.
meet you. Yeah, you were great. I like the way you're telling us this. It's there's a lot of information.